If everyone wait for me. Okay. So in 1938, cystic fibrosis was first discovered by American pathologist Dr. Dorothy Anderson. And she discovered it by looking at the autopsies of malnourished children who, what she found in common was clogged exocrine glands. And this is going to be important as we see later on in the diagnostics of it. But first I want to point out the prevalence worldwide. There's about 70,000 people who are affected by cystic fibrosis. And this is a staggering statistic considering that there is no cure for it, only symptom management. So cystic fibrosis has advanced greatly since the origin of it, but there is still no cure for it. There's only symptom management and treating the condition as it arises. First, I want to begin with the origin of the disease, and the origin and the first diagnostic test for it, which began with Paul D. St. Agnes, who discovered that many children fell victim to the 1948 New York heat wave. And from here, he was able to further create the sweat test in 1948, which according to the Gale Encyclopedia of Genetic Disorders, edited by Laura J. Fadjikin, a small amount of the drug polycropine is placed on the skin and a very small electrical current is applied to the area, which drives the polycropine into the skin. The drug is absorbed onto a piece of filter paper and then analyzed for its salt content. A person with cystic fibrosis will have salt concentrations that are 1.5 to 2 times greater than normal. So this hits back to the origin of the disease with Dr. Anderson, in that the exocrine glands were clogged, and exocrine glands are responsible for sweat secretions and other secretions such as that. And the second point I want to touch on for the beginning and origin of cystic fibrosis is the finding of the CFTR gene. And this gene is what is mutated and causes all the problems of cystic fibrosis. So this leads into the second part of my talk, and that's the current treatment and management of cystic fibrosis. So gene therapy is used to help remedy the problem of the CFTR gene. However, it does not fix the problem of the gene, only the offspring that the gene creates. It would be like having a factory that's created t-shirts that are not up to par, that are ripped or broken in some way, and you go in, the workers would fix the t-shirt, but they're not fixing the factory that's producing the broken t-shirts. So that's what gene therapy is doing. It's fixing everything, all the outcomes that are broken, but it's not fixing the problem in general. And the second thing that's happening is the implementation of preventative medications that keep cystic fibrosis patients from being hospitalized. And the more that a cystic fibrosis patient is hospitalized, the more likely they are at acquiring a nosocomial infection, which is a hospitalized infection. And cystic fibrosis patients cannot fight these as normal patients can. So it becomes incredibly risky for them to have these. So having preventative medications is very important in decreasing mortality for these patients. And my last point I want to talk about is the future of cystic fibrosis, and that is the idea of perfecting gene therapy in order to completely either prevent it or rectify it so that the patient can be without symptoms for the rest of their life. And we are still far from doing this. So perfecting gene therapy would be, as in my earlier metaphor, would be fixing the factory that was creating all the mutated or wrong t-shirts. It would be fixing the gene that is creating all the mutations. And the second thing is the rising in awareness of cystic fibrosis and the funding that it is now getting. And because of this funding, they are able to come up with new drug therapies and new ways to treat cystic fibrosis that will eventually be curative. In conclusion, cystic fibrosis is a genetic disorder that has no cure, only treatment and symptom management. As we continue to advance further on, researchers are going to look at the past as well as look at the present clinical trials in order to come up with a future solution to this problem. But for now, it's like the lottery. You don't know if you're going to get it, and there's nothing you can do to lower your risk factor. All you can do is understand how the disease works and how early prevention can help increase standard of living. Thank you for your time.